My name is Vehniah Tjong. I'm an orthopedic surgeon with a specialty in sports medicine and particular interest in hip and knee arthroscopy as well as shoulder arthroscopy. The CDC has released that orthopedic surgeons are responsible for about 8% of the number of prescription opioids given across the United States. Here at Northwestern Medicine, we're doing some really exciting research looking at why the opioid epidemic is happening and what we can do to help it. There's little consensus among orthopedic surgeons, even for particular procedures, how many narcotics are actually required. And so this was sort of the forefront of our research. First, looking at hip arthroscopy patients, just answering the question, how many opioids are these patients actually requiring after surgery? And what we found was, number one, we're definitely overprescribing. So prior to all of this research, the common prescription was around 60 tablets of Norco. And what we found were patients were requiring less than 15. And then from that review, we kind of extended it to our ACL population, so ACL reconstruction, and then with just simple knee scopes. We did a randomized trial looking at ACL reconstruction patients, giving one cohort 60 tablets, the commonly prescribed, versus 30 tablets. But what we found that in both groups, they take about 10 to 12 tablets, regardless of how many they give them. Probably the most interesting of all the research is with simple knee scopes. These guys typically get 20 tablets of narcotics. And what we found was 30% of the people with just simple knee scopes required 0 opioids at all. We have found a couple of preoperative factors that do predict patients needing more pain relief afterwards. And these are patients who have had preoperative use of opioids. So within 3 months of their surgery, whether it be other pain-related issues, if they needed narcotics, then most likely those guys are the ones who will take more after the surgery. So I think that as surgeons, we have to realize that we can be guilty of overprescribing for post-operative pain, and that's the first step. Secondarily, the whole multimodal pain management program, it allows patients not to rely on their prescription opioid medication and really focuses on how they can manage their pain in other ways. Exciting result from our research is that we found that really no matter how many prescription opioids you give a patient after a particular surgery, on average, they require the same amount. So I think by prescribing less opioids, we can directly or indirectly help the patient and decrease the burden of any medical complications, addictions, costs that they may have in the future.